Hello, all welcome to today's edition of Time with the Dietitian. I trust we are all doing well. We are all welcome once again to this month's edition of Time with the Dietitian. Time with the Dietitian is a program organized by the Wellness Center, KNUST, and it seeks to educate the public on nutritional issues, making us well abreast with the current trends and other nutritional tips that can help us live a very healthy lifestyle. So if you are just joining us this month, you are VVIP, you are very welcome. And we have this meeting once every month, second Thursday of every month. So you can just put it on your calendar, mark your calendar, invite someone. That's on the second Thursday of every month at 2 p.m. KNUST Wellness Center will come their way with Time with a Dietitian. So we thank God for our lives and giving us this beautiful Thursday for us to gather here once again. So maybe you might want to share the flyer on your status. You can post it in any of the WhatsApp groups you belong to so that someone can benefit from today's discussion. And trust me, today's discussion is something that concerns all of us. Everybody is involved in today's discussion because you and I use a spice. You and I know of a herb, if not a herb that has been passed on to us from generations. Our grandmother used it, our mother used it, so we inevitably use the same herb or a spice that is unique to us, our own manufactured spice, a spice in the market. Today's discussion concerns all of us. Herbs and spice is something that we are used to. If you eat, that means that there is a spice in the food that you've eaten. We have herbs that have been passed on to us, as I was saying, from generations. So our mother used it, our grandmother used it, so we inevitably use it. Certain herbs that we use when we have certain conditions or depending on how we feel in our bodies. So this afternoon, we have a resource person in our midst. She's the right person for this discussion. And we hope that at the end of the day, you and I would know what to do, which option to go for, what herbs to use, irrespective of the condition we might have or whatever the condition we have or our health aim is. In achieving a healthy living goal, we need to be abreast with the herb or the spice that we need to use. So this afternoon, our resource person is a registered dietitian. She was once my clinical supervisor when I was at Confirmatory Teaching Hospital. So she's a very close most senior colleague. And her name is Mrs. EFUA OWUSU-ANSAH. She's a principal dietitian at Confirmatory Teaching Hospital. She's also the CEO of Enjoy Your Health Consults and Mel Goshet Foods. So Auntie EFUA is the right person. Auntie EFUA, as I affectionately call her, is the right person for today's discussion. So Auntie EFUA, please, if you are here, I know you are here.
Good afternoon, everyone. And once again, I'm glad that I've been given this opportunity to share my little knowledge about spices and herbs. And I am praying to God that by the end of this discussion, which I'll open the floor for us to discuss and give our experiences with all the different spices that we have in our locality. We will be able to learn from each other, and we'll be able to learn from each other and have the benefits as we eat healthy to try and prevent diseases. So we have spices and herbs, and most of the time we bring them all together, or we just jump them all together that they are the same. But in terms of spices and herbs, they have bioactive molecules which are known to be anti-inflammatory, anti-tumorigenic. That means they prevent tumor formation. They are known to be anti-carcinogenic. So there are some types of cancers that, depending on the spice or the herb that you are frequently using, will help to prevent the cancer from starting, or even in its treatment or management. Exposure to the bioactive ingredients of these spices and herbs are able to help with the prognosis. Some are also known to help regulate glucose and cholesterol levels in our blood, as well as affect our mood and how we think. I know some people who take specific spices depending on how they feel during the day. I'll give you some of the experiences of people that I have heard. Spices and herbs, spices are more of the grains and the nuts that we see around and we use in our day-to-day meal preparation. Herbs are mostly the leaves. They are more of the leaves. So we have the parsley, we have the basil, we have rosemary, we have all the other those that are plant-based, or they are all plant-based, but those that are leaf-based. And basically, with what we see and experience, we know that spices and herbs are to enhance the flavor in our food. Assuming you are cooking tomato stew and there is no spice, nobody will salivate in the house. But if you are to add curry powder or any of the other spices that we know of, whether combined, curry powder is not a specific spice, but it's a combination of spices that we use in our meal. Adding that to our meal will add flavor to it. And I was just giving an example. Preparing tomatoes stew, you realize as soon as you add the curry powder, the aroma just bursts in the environment. Wherever you find yourself in the house, you will start thinking of the end product of whatever is happening in the kitchen. It also helps with the color. Even with a turmeric, for instance, turmeric, it looks like garlic. I'll show you that it looks like ginger. I'll show you the picture. But even using your hand to mix it or do anything directly with your hand, it will color your hands. And these are natural colorants that adds the appeal to our food. So herbs and spices, not just their bioactive ingredients, but also we look at the other benefits that are not directly to our health, but enhances our appetite and the way that we eat our food, whether we eat a lot or we eat very little. Then it's also known to help prevent some acute and chronic non-communicable diseases. When I started my practice, I was always referring to diet-related diseases. But after a decade of doing this work, I've realized that all conditions are diet-related. Even if you are going to undergo surgery, if your nutritional status is poor, your prognosis after the surgery will be poor. So that means every food that you eat has impact on all aspects of your body or all parts of your body. And spices and herbs are known to prevent the acute as well as the chronic non-communicable diseases. And if it will also enhance your intake, I think even when the infectious diseases come and your nutritional status is good, you'll be able to fight against whatever pathogen that is worrying the body. Let's go into some studies that have been done with spices. One observational study that I found, they did it among spicy foods. And in Ghana, when we say spicy foods, it's all about, it's like there's too much spice. But outside in the Western world, that means it's too peppery. But in this study, they were talking about spice in general, and they did it among Chinese. We know that this group of people have a lot of spices and herbs that they use in their meal preparation. This study was done with 487,375 participants between the age of 30 and 79. And after a median follow-up of seven years, 2 months, this is the conclusion that they came to, that spicy foods of people who add spice to their meal have improved health in general. And when compared with those who eat spicy foods just less than once a week, those who ate spicy foods 1 or 2 days in a week had 10% reduced risk of death with an odds ratio of 0.90. And they also found out that those who ate spicy food 3 to 5 times and 6 to 7 times a day or a week, days in a week, have 14% reduced risk of death. And foods almost those who eat all their foods every day from morning to evening, if their foods are spicy, they also were seen to have 14% lower risk of death compared to those who consume spicy foods less than once a week. They also found that those who ate spice foods or foods that have been spiced had less chances or lower risk of death from cancer, ischemia, from heart diseases, respiratory diseases, and this benefit was seen more in females than in males. I don't know why, maybe because we have more fat than men do. I don't know the mechanism yet. I'll study on that, and maybe our next presentation, I'll explain that to you. Now, let's come to the specifics. I can tell you all, we have varied spices and herbs in our system. We have the local ones and even the foreign ones. They are now very available in our markets. They found out that people who ate spicy foods or foods with more spice had a less likelihood of using more salt in their meals. And this, I quote it from Lee Kill and colleagues. They said that enjoying spicy foods may significantly reduce individual salt preference, daily salt intake, and blood pressure by modifying the neural processing of salty taste in the brain. Therefore, application of spicy flavor may be a promising behavioral intervention for reducing high salt intake and blood pressure. And with this, they explain that the transmission of the brain to sense salt is heightened when you eat foods that have spice. So if your salt sensitivity is heightened, very little salt, and you taste it enough that you enjoy the meal. Because most of these plant foods as well, they contain their own natural sodium levels. Apart from this connection of neural effect, they also have their own levels of sodium, which can add up to make our food more tastier, so we don't have to depend on salt in our meals to give us the taste and the enjoyment that we so want. Now let's come to cinnamon. Cinnamon is in Ghana. We have trees, cinnamon trees around. Most people don't even know that is cinnamon tree, and they just sit under it and just enjoy the shade, whilst the bark of the tree can be used for these benefits I'm going to outline. This is a spice that is known to have a lot of antioxidants, specifically polyphenols. And we know these antioxidants are they fight against free radicals. Therefore, they are anti-inflammatory, antibacterial, antifungal, antiviral benefits as well. Therefore, including cinnamon as tea or in baking. And most of the time, the processing with these spices can either heighten their benefits or reduce their potential benefits to the person taking it. But it is known to have bioactive substances that are anti-inflammatory. So, and we know that diabetes, hypertension, and all these kidney diseases and heart diseases are mainly because of heightened inflammation in our body. That is because of either genetics or our stress level, our day-to-day stress level. So if you have cinnamon in your inculcated in your diet, as I said, whether in tea or in other in baking or other things, it will help to curb or reduce this inflammation in the body. It's also known to improve insulin. I always tell people that no matter how heightened your genetic predisposition to any of these non-communicable diseases is, depending on your dietary lifestyle or your modifiable lifestyle, which diet plays a lot of role, you'll be able to either prevent the onset or delay it to the point that maybe in your 80s and 90s, where the body is so weak, the parts of the body have been overworked, that's when these conditions will come in. And even with that, because of your healthy lifestyle, healthy nutrition, you'll be able to better manage it than someone who eats anything anyhow. So cinnamon is known to help improve insulin sensitivity. Therefore, any sugar that is in the bloodstream, the body is able to sense it, and insulin is able to take it into the tissues as God planned it to be. It's also known to reduce the risk factors for cardiovascular diseases. And diabetes is part of the risk factors for cardiovascular diseases, and as well as blood lipid levels, specifically cholesterol. We have the triglycerides, the high density lipoproteins, then the low density lipoproteins. Cinnamon is known to have effects on that. It also helps, someone will say detoxification, someone will also say helping to build up the HB. But cinnamon is also known to help with HB. It's possible is the iron content in it. But remember, any iron level in any plant-based foods is also not well absorbed if there is absence or low levels of vitamin C in that diet. But it is known that cinnamon can help, as it is helping with the HB level. It also helps to prevent blood loss. Blood loss in terms of if you get injured or you get into any accident, it helps to coagulate the blood very well so that you won't lose that much. It's also known to have activities against neurological disorders. At first, Parkinson's diseases, Alzheimer's diseases were known to be in the Western world. But even in Konfanochi here, we have a group of people who have been diagnosed with Parkinson's disease, and they have been grouped together to help support each other. So it is something that is in our midst. Therefore, so pepper or cloves have been known now to help both male and female. and it's a fragrant and a very wonderful spice that is also known not just for the human body. Some people burn it for as insect repellent. Some people use it in their skincare routine, but it is also known to help with both bones and other hormones, both male and female hormones. It is not, some people do tea with this to improve female fertility. Males are also known to benefit from this spice. It's also a good source of vitamin K, potassium, beta carotene, which is good for our eye, vitamin A. And it's also known to have antioxidant, anti-inflammation properties, as well as reduces ulcers, improves liver function. So that's why I was talking about detoxification. The main organ in the body that is responsible for detoxification is the liver. And there's no need to do any concoction for the body to detoxify itself. Drinking a lot of water will detoxify the kidney. And as you drink a lot of water too, it enhances the liver to do its own work. But the bioactive ingredients in cloves or pepper are also known to help the liver work very well, to do their Zoom lion work. And including this will help in our meal preparation. But we should remember that the chemicals in all these, I'll mention that later, but the chemicals in all these spices are very strong. So we use them in little quantities and you can still get the benefits. I know some people hearing the liver inflammation, antioxidants, they want to use it in everything that they do during the day. But exposure or overexposure to these chemicals are also known not to help the body in the long run. Now let's come to ginger. Ginger was the spice that I was mentioning earlier. I know some people just pain in the body. They feel weakness or pain during the day. They just put ginger in their mouth and just munch on it, swallow the juice, and the pain is gone. We know that it helps with inflammation as well as nausea, especially females or women who are pregnant and have morning sickness. Having ginger as tea or it's being dried and you putting it in your mouth help reduce the nausea feeling for you to eat well, for the fetus or the baby to also grow well. It's also known to help with digestion. I know some people have, as soon as they are told they have gastritis or they have any form of ulcer, they want to go off any spicy foods. But the longer or if your meals overstay in your stomach or in your where it is being processed or digestion, then you are also having overexposure of the acid in the body to the membrane of the stomach. Therefore, anything that will help to for the body to digest the meal well is something that we should include in our meal. So I know some people who will just do ginger tea after their meal. Even after they've added ginger in their meal, after their meal, they'll just sip a small Queen Elizabeth size mug, not the Ghanaian size mug of ginger tea to enhance digestion. It's also known to help with osteoarthritis and gout. It helps with lowering of blood sugar, blood cholesterol, and also improve the heart disease risk factors. And as I said earlier, hypertension, diabetes, cholesterol are all major risk factors for cardiovascular diseases. So if you have anything that will help reduce or prevent the onset of these conditions, then you are invariably also helping to hack. As I mentioned with the cloves and the other spices earlier, ginger is also known to help with Alzheimer's as well. So in terms of brain health, ginger helps to improve the neurological function of the body. Now we have many of you did a lot of tea with prekese, and we've not conducted any study yet, and it should be something that we have to do. Okay, and I think someone can pick it up. We know the benefits, but are there other factors that helped us to prevent or reduce the severity and the prevalence and the incidence of COVID amongst our population? But we know that during COVID, we took a lot of Precase. Precase is known to have a lot of benefits. And I know some people who were on antihypertensives, but when they started Precase tea, and the Precase tea, they just cut the soft part, the soft two edges of the Precase, and just crush it, dry it, and use it in tea. Some people have been taking off their antihypertensive medication because they are on Precase tea. And as I was saying earlier, the bioactive ingredients are very strong. The strength is very strong. So it's very little in your tea and you'll still have the benefits. It's known to be rich in flavonoids and phenolic compounds, as well as having antimicrobial, anti-inflammatory, anti-diabetic, anti-parasitic, and anti-proliferative activities as well. In terms of wound healing, Precase is known to help a lot with convulsion management as well as analgesic properties. So aside the ginger that I mentioned, that some people with pain, body pain and headache, they are able to have a relief when they take ginger. The same with Precase, adding it to your stews or your soups. Sorry, I know some people have even done Precase powder, that they don't just put the Precase whole in the soup, they add the powder to it, and with that they are also including the fiber part of their Precase. It's known to boost our immune system. No wonder by God's grace, we were able to fight COVID-19. It's also known to have good effects on on cardiovascular diseases. And as I said, with all the others, if your sugar levels are affected, if your blood pressure levels are affected, invariably your heart health will also be in good shape. Now let's come to the almighty garlic. Garlic now I know some people chew it, I know some people drink it, I know some people do a lot of things. It's known to be one of the magic spices that is available to us. Garlic is in the same family as our onions. It's known to have antibacterial, anti-parasitic, as well as having effect on especially our cholesterol levels. Some people have even done capsules with it, but the way God created the human body, the body does very well with the meal that we eat than with supplements. Unless someone is deficient in a particular compound or chemical, the body will prefer to utilize the nutrients or the chemicals in our meals than in supplements that we are taking. So those of you who are already on garlic supplements and other supplements, you might somehow be wasting your money, because the body might not absorb it as best as if it is added to your meal. So in meal preparation, some people will ask, should I drink the ginger, the garlic, should I swallow it, or whatever it is that you are using it for. If you are using it fresh, that means you can prepare some vinaigrettes and just pour it on your salad, and that is a fresh garlic. Or in your meal preparation, you can just add it and you still have the benefit. As I said earlier, again, there are some chemicals in these spices that depending on the meal preparation, you can get more benefits or not. Some benefits will be enhanced when you cook, others will be reduced when you cook. So varying the methods of cooking also help to harness all the benefits that come from garlic. But the downside of garlic is that it causes halitosis, that is bad breath. As we know, onion also causes that. So it will be prudent for you to think that just because of your benefit, you chew it and let the entire house or the entire office suffer from your bad breath. So as much as possible, find a way that maybe you absorb it before you get exposed to people and speak on them with your garlic breath. So that is the main downside to it. But in terms of whether you crush it to cook it or you blend it to cook it, it is known that plant-based foods, if it is grinded, it is better absorbed and better utilized compared to you just cutting it and trying to chew it, because the cell walls are tougher than animal cell walls. So that is the issue with garlic. In terms of basil, we have our akoko mesa, we have different varieties. I think this one is the abrofo variety that is, I know some people have already planted some and they get the benefit from it. It's a green leafy herb that helps, it has vitamin A. It's also known to help lower blood sugar. It's also known to have, because of the fiber, it's not that much, but it helps contribute the total fiber that you are supposed to eat in a day. It also improves the flavor. Adding basil to your chicken, for instance, reduces the nauseating feel that chicken gives if it is not cooked well. And so basil has these benefits in addition to more depending on how it is cooked. Now we have turmeric. We can grow them. In fact, please, these spices have, especially turmeric and others, have been overpriced in our setting. You get very little and it's very expensive. But if we can grow ginger, then we can grow turmeric. So turmeric, you can just buy some lettuce sprouts and you can grow it in a pot in the house. And you can enjoy all these benefits from turmeric. Apart from it adding color to your meal, it is from its active bio ingredients, that is the curcuminoids, is known to help with cancer by scavenging free radicals, and is also known to inhibit lipid peroxidation and LDL oxidation as well. It's also known to prevent DNA oxidative damage. It's also known to help with inflammation in the body as well. It's also effective when taken in smaller quantities. So don't think that because of all these benefits, and it goes for all the spices, you will take it in bigger quantities. You are just wasting your money. Just small quantities in your meal. Maybe you alternate your ginger tea with your turmeric tea. Maybe if I take this in the morning, I take this in the evening, or I alternate the days that I'll take these ones. But a study that was done showed that the lower doses of the active ingredients of turmeric powder help to reduce LDL and total cholesterol as well. So when you think about all these spices that there are many more. We have the wintia, we have the fenugreek spice, we have all the others there. You realize that they all have their benefits. We should be explorative enough. And it's not all spices that go with every food. In fact, if you are preparing some foods and you add some spices, because of their oils in them, the food might not be edible to the entire family. You will say that it's medicinal, but nobody can eat that food. So let's be explorative. Let's keep experimenting with these spices. And if possible, if you need to do any combination, do it yourself after experimenting with them. There are some spices that are specific for soups, some are specific for stews, some are specific for soups, and even that one, depending on the type of protein that you are adding. If it is a red meat, if it is fish, there are different spices that are used, not just for their chemical effects, but the flavor and the other benefits that are not necessarily medicinal, but they can help increase appetite or reduce one's appetite. So curcumin, that is the active ingredient in turmeric powder, has also been shown to be effective against development of hepatic steatosis, that is fatty liver, and it also reduces the progression of steatohepatitis. So it's those with fatty liver and others, they are known to help reduce the progression or prevent the onset of these fatty liver or hepatic steatosis, or you having stool fatty stool in your or passing out fatty stool. So this is the benefit of the turmeric powder or turmeric spice. As I said, I wanted to leave more room for us to discuss some of the benefits that we have experienced on our own. Especially the ladies have to talk a lot here, so that we will share all the benefits that we can get from spices and herbs. Thank you. So anyone with any inputs or any question?
Yes, my name is Gifty.
Okay.
Yes,
Nice.
so my personal experience with turmeric has to do with its benefits on the skin.
Mm.
And it also has anti-aging properties. So both men and women can, utilize it, whether by drinking it as tea in the morning, in the evening, as the speaker indicated. Or sometimes you can even pair it into a paste. If you have dark spots on your face, you can prepare it and then apply it on your face, wash with warm water, and it's always beneficial for the skin.
Thank you very much.
When you look at rosemary, hello?
Hello, please, you can go ahead.
Yes, when you look at rosemary, and one other spices she mentioned earlier, I don't know whether it's the pepper or the yes, I think one of them. When you combine, yes, the pepper. When you combine rosemary with that and you add your hair oil, it's very good for hair growth. Healthy, shining hair growth. So that's just a bit of experiences that I want to share. So instead of us to actually waste money or not waste, but spend so much on cosmetics and other things, we have the natural spices that we can take advantage of. Thank you.
Thank you. I want to add a little to what Gifty said. In terms of skin, in fact, for over many years now, I just mix turmeric powder with my shea butter and my virgin coconut oil, and that's what I use to pomade myself. It's known to help with natural skin tone. So for us females, I know men, most of you don't even pomade your skin, but for us females, it's a good way to have the natural benefits. And remember, whatever you put on your skin, whether head or the rest of the skin, it's absorbed into the bloodstream. So if it is chemical based, then be assured that you are burdening your kidney to get rid of these chemicals that you are putting in. So it also helps. Just inculcate that in your pomade, and you have a very nice skin tone. Thank you.
Auntie Efua, could you kindly repeat your combination?
Oh, okay. The combination. In fact, I do the shea butter. Then I do cocoa butter, the raw one. Now people sell it in kilos. So I do the cocoa butter, then turmeric powder, then the virgin coconut oil and olive oil. I mix that together, and that's the pomade for the entire house. It doesn't smell bad. If you want extra smell, you can add your lavender essential oil or any other oil, but it doesn't have any scent, and that will help to tone your skin well. Thank you.
Thank you.
So any other contribution or question?
Hello. Another one I just remembered with the onions. Usually, even as mothers and parents, when your child, I'm sorry if I missed something, but I didn't join in earlier. So this is just one other suggestion. When usually the children get catarrh or cold, it's always advisable to cut onions into pieces and put it in their socks, even while they are sleeping. And you'll be amazed at the results in the morning. Yes, so that's also another way of using onion. Apart from eating it, you see, apart from having it in your food, you can always try that, even as adults too. And then this one, the presenter would have to confirm it for me. When you blend onions in the morning and then you drink it in very moderate quantities, it helps blood sugar. It also helps your blood pressure, and even helps in cholesterol management. That is a personal experience from my mother. So maybe she would have to also, I don't know if she has any idea on that. She would have to confirm that. Thank you.
Okay, I think I mentioned that garlic is in the same family as onions. So I'm not surprised that your mom is able to have those benefits from onion, since garlic, it's no wonder. So I'll also look into it and find out how these benefits are enhanced. Thank you. So in summary, I said that I am not surprised that onion is able to have that effect, but I always tell people that taking these things in isolation and not thinking about the other factors that are contributing to the onset of a condition will just disappoint you, because if you do the onion therapy very well, and your weight and your timing of meals and other parameters that are informing your blood sugar or blood cholesterol are not looked at, you have the temporal benefits, but in the long term, you might just be piling up.
Auntie, please, I think that was all.
That was okay.
Yeah.
So
yes, please.
I can conclude here that please let's stop the adobos and the others. Eating your food right now, you will enjoy it. But I always ask people that after the food has left your mouth, what benefits are you giving the body in the long term? Let's look at these natural spices that are available to us. Instead of waiting to use your money to buy medications later, let's invest in these natural spices. Include them deliberately, consciously in our meals. This is just the beginning. Learn more about these natural spices. But the caution is, don't think that they will in their or on their own solve all your medical conditions. They work in families. Therefore, in little quantities, include them and be conscious of how different cooking methods can either enhance or prevent you from getting the benefits that they provide. Thank you very much for this opportunity.
Wow. Thank you so much, Auntie, for I think today's discussion has been very, very insightful. And thank you for making it so practical and so relatable. I believe we are all living here well informed as to what to do. And I really like the answer you gave to the question that was asked before you went off, that we should look at the overall healthy living strategies and not just picking out on one thing and focusing on that, but we should look at how collectively every healthy food plays in maintaining our health goals. Thank you so much. Please, I don't know if anybody has any question for us before.
I think somebody was asking in the chat the combination Auntie Gifty gave for the hair.
Hello.
Hi.
Hello.
Hello, yes, please.
Yes, so I said the rosemary and the pepper, cloves. Yes, please.
Okay. Thank you very much. Thank you very much. Auntie, please, did you want to add anything?
No.
And the hair oil, yes. I think the virgin oil.
Yes, the virgin coconut oil and the virgin olive oil. I think these are all okay. Then the other, in terms of hair regimen, even the onion helps a lot. But it's not everybody who likes the flavor. But onion and garlic are also very good for the hair as well. If you want to do deep treatment, instead of these chemicals, just get the juice of onion or garlic and just infuse it in your hair. And it will help penetrate into the follicles and give you the benefits that you seek.
Okay, so my question and my concern, hello.
Yes, please. Please go ahead.
Yes, please. My question is with the turmeric, as Dr. Ifwa indicated, mixing it with shea butter and all that. But the challenge is that when you even wear any dress, especially a white dress, it stains it, and then even your nails. So what other advice you have? How do we manage that?
So that's the downside to it if you are not careful with the quantity you are adding. It's just something very little. Don't use a lot, or you stain all your dresses, and it might not come out. So something very little, and you still have the benefits. Unless you want to do a serious treatment and you are wearing your Adam and Eve clothing in the house, you are not wearing anything, then you can do the entire body and do it a deep one. But if you are doing it for every day, then very little. I think for the entire house, I don't even do 1 tablespoon. It's something very little, and I mix it in.
All right, thank you.
You're welcome.
Right. Thank you very much. I believe if we have no other questions, then we can end today's discussion here. Thank you so much, Mrs. EFUA OWUSU-ANSAH. I believe we all agree with me that she was the right person for this discussion. And maybe with her permission, we can share her contacts as well. She has her own brand of foods that she does, some for baby feeding and for adults and cereals as well. So we will share her contacts very soon. Please, there was a link that was pasted in the chat box that we should join a WhatsApp group. So we are trying to we've actually set up a WhatsApp group for Time with a Dietitian where you can be updated on our meetings, because we don't want you to miss any meeting. We want you to be present here. I believe you've learned 1 or 2 things and you are going out there to spread the good news on herbs and spices. Thank you so much for joining us for this month's edition. And please be reminded that we will meet again here on the 12th of September. It's a Thursday, like this, same time, 2 p.m. for another insightful discussion. So thank you so much for joining. The Dietitian at the Wellness Center is also present every day from Monday to Friday. She starts work at 8 a.m. and closes around 4 p.m. So you can just make your way to the Kenwesi Wellness Center to see the dietitian. Thank you so much for joining us once again, and we'll see you same time next month. Enjoy the rest of the month. Thank you.